you're dealing with one-sided hip and lower back pain or sciatica, it often comes down to a combination of tight and weak muscles in that area. And a lot of times the glutes and the quadratus lumborum, that's a muscle in your lower back, are the main culprits. So I'm breaking things down into two simple parts for you here today. First, we will focus on stretches to relieve the tension quickly. And then we'll dive into strengthening exercises for that longer lasting relief that you want. Now, the goal here is for these two types of exercises to work together for the best results. So feel free to combine them and do whichever ones you feel give you the most relief. Now, the first stretch is a variation of one that we call the butterfly stretch, which is great for opening up your hips. This will help with mobility in the hip joint itself, especially if arthritis or any sort of stiffness is a concern in the hips. Now, to do this, you're gonna lie flat on your back. You could do this on a bed or on the floor, and bring the soles of your feet together, and now gently press your heels downward. Now scoot your feet towards your hips and pelvis and press your knees down towards the floor. This will stretch the inner thigh and the groin. You're gonna hold that position for 3 to 5 seconds and then bring your knees back up. Repeat the motion like the flapping of a butterfly's wings about 10 to 15 times. Now, if you need a deeper stretch, gently press your knees downward using your hands, but only as far as it feels comfortable. Now listen, everyone's flexibility is different, so please let me know in the comments down below if any of these exercises are a little too painful or too challenging. I am happy to suggest alternatives for you. Next, we're gonna work on a stretch that targets the glutes and the muscles of the lower back. So let's say the pain is on your right side. You're gonna cross your right ankle over your left knee and then gently pull that right knee toward your body. You're gonna feel the stretch across your hip and lower back. You're gonna hold that position for 20 to 30 seconds and repeat it 3 to 5 times. Each time, see if you can deepen that stretch just a little bit more and then switch sides to keep things balanced. Here's another really simple stretch that you can do while you're standing up. Now, if your pain is on your right side, you're gonna cross your right foot over the left, making sure that the foot is positioned so that you feel a stretch on the outside of that right hip. Now, place your right hand overhead and your left hand on your left hip. Now begin to lean toward the left side while pushing your right hip out to the right. You're gonna feel a deep stretch from your low back all the way into your hip, and you're gonna hold that for 20 to 30 seconds, repeating 3 to 5 times, gently building and deepening the stretch with each repetition. For a more intense stretch, you can try adding a bit of a twist with your upper body, turning your torso to the left. Hold that position for 5 seconds, and then repeat 5 to 10 times. If you're sitting at a desk or in a chair, here is a seated stretch to help relieve your hip and lower back pain. Cross your right ankle over your left knee, forming a figure 4 shape with your legs. Now gently pull that right knee toward your left shoulder, and you're gonna feel a great stretch along the outside of that right hip. Hold that position for 20 to 30 seconds, repeat it 3 to 5 times, and each time try to deepen that stretch a little bit. To take it further, you can press your right knee gently downward with your own leg strength, or you can lean forward into it for an even deeper hip stretch. Hold that position for 5 seconds and repeat it 5 to 10 times. Now, let's talk about strengthening exercises. Strengthening the muscles around your hip and in your lower back is absolutely essential for long-term relief. Here is an easy exercise you can do while lying on your back that's called the dead bug move. You're gonna start by lying flat with your knees bent at 90 degrees. Now slowly straighten the leg on the painful side, keeping your foot hovering above the floor. And this is gonna engage your core and the muscles called the hip flexors. You're gonna hold that for 3 to 5 seconds and then return to the starting position. For an exercise that targets the lower back and the hips, try the clamshell bridge. And again, please let me know in the comments if any of these exercises are too advanced or feel too difficult for you. I will be happy to suggest alternatives. All right, so for the clamshell bridge, lie on your back with your feet together and your knees bent. Gently press your heels down into the floor, and that's gonna activate your gluteal muscles. Now, try pressing your knees outward as if you were trying to widen your legs. You're gonna hold that position for 3 to 5 seconds and then lift your hips toward the ceiling, creating a straight line from your knees all the way to your shoulders. This is going to strengthen your core, your lower back, and your hips. You're gonna start with 10 repetitions, and if that feels good, add another set. For a standing exercise, you can do the hip hiker move using the edge of a step or a stair. With a painful side of your hip facing away from the step, step your other foot onto the edge and now lift your painful side hip upward as high as you can. This will activate the quadratus lumborum muscle, a muscle that's often responsible for one-sided or unilateral back pain. Hold that position for 3 to 5 seconds and then lower your foot slowly. Do 10 repetitions on each side and challenge yourself to add more sets as you begin to feel stronger. Now, remember that combining stretching and strengthening exercises will help you manage your hip and your lower back pain. But it's also important to ask yourself why you're in pain and how did this happen in the first place? Was it from a subtle pain that gradually got worse? Was it from an old injury that's now coming back to haunt you? These are the kinds of questions that I ask my patients so that we can get to the root cause of that pain and treat the cause, not just the symptoms. And yes, often pain can be the result of imbalances in strength to flexibility. And often the pain is coming from excessive inflammation. And that's something that conventional doctors don't talk enough about, often don't even take it into consideration at all. If you want to know whether or not you have excessive inflammation, watch this.